Okay, so now we're going to talk a little bit about continuous ultrasound again. We're still measuring the intensity in watts per centimeter squared, and the time is in milliseconds. So now you can see that it's just going. It's continuous. And so this is going to create that thermal effect that we were talking about. So this is probably not something you're going to want to do in the very acute stage. You're going to wait till you get into that proliferation and the maturation phase where you're starting to want that benefit of the deep heat and the vasodilation that we get that helps with that promotion of healing. So we know that you get this acceleration of metabolic rate. I think it's about 1 degree Celsius that we start getting an increase in metabolic rate. You get a reduction or control of your pain and muscle spasms. That alteration of nerve conduction velocity, this should all start sounding familiar with other thermotherapy modalities that we've talked about. You get the increased circulation, the soft tissue extensibility increases. You have a mild inflammatory response, which is sometimes what you want when you're wanting to get a little bit of blood flow in there to promote some healing. It heats smaller areas more deeply than superficial heating agents, and we talked about that. You can go up to about 5 centimeters depending on if you're using the 1 megahertz intensity. It will heat tissues with high absorption coefficients with high collagen content. Remember, we talked about that, like such as bone and tendon and ligament and fascia, versus the ones with the higher water content. And I'll let you try and see if you can remember which ones those are. So these are a couple studies. This one I believe came from the JOSPT in 2006. I can get you that reference if you would like. I just forgot to put it on the slide. Apologize for that. Let's see if I can find that for you. I'm going to put this on pause for a second. So yeah, there was 2 studies that kind of talked about the increase in metabolic rate and the muscle spasms and collagen extensibility and how hot the tissue has to get in order to get those therapeutic benefits. And the first one was back in 1967 by Lehman and Lehman in Physical Medicine. And then we had the JOSPT one in 2006 that talked more about the speed of the sound head. And then we got to Draper and Chan, who talked more about the muscular effects of and the amount of time that you needed to actually get those thermal and non-thermal effects with ultrasound, and we'll get to that in a little bit and show you a formula so that you can understand when you change the intensity that you might have to either decrease or increase the amount of time in order to get those therapeutic effects. So back to this, if we raise it by 2 to 3 degrees, you'll get the therapeutic effect of decreasing the muscle spasm, pain, and increasing the blood flow. You need more than 4 degrees Celsius in order to get that collagen extensibility that we talk about. And this is what really great to use ultrasound and then do your joint mob right afterwards if you're trying to get some increased collagen extensibility and improved range of motion. So this is a couple examples. So remember the 3 megahertz, that's the more superficial. And with superficial, it means it's going to heat up faster, so we keep that intensity lower. So somewhere between 0.8 and 1 watts per centimeter squared is usually what we do. And sometimes you can go down as low as 0.5. I usually start at 0.5 and move my way up just to make sure that the patient is comfortable. And so this is an example of using 3 megahertz at 0.8 watts per centimeter squared. That increased it by a half a degree per minute. Okay. And then if you did the 1 megahertz, which was the deeper one, remember that can go to about 5 centimeters, you can raise the intensity a little bit more because it's going deeper, so it takes a little longer for it to heat up. And that's this one at 1.5 watts per centimeter squared, it increased it by a third of a degree. It cools down quickly. With the superficial, it's about 3 to 4 minutes and that effective heat is gone. So if you're going to do something, you need to do it pretty immediately. You have a little longer time when you're using the 1 megahertz going to the deeper muscles. You have about 7 minutes before you lose that effect. Okay. So the different things that affect the tip of tension, we talked about the absorption coefficient, so that's obviously the amount of collagen content that's there. The higher the frequency, the more the temperature is going to go up. How long you do it for, if you do it for a longer period of time, you're obviously going to get a higher temperature change. Average intensity, higher intensity, it's going to be a higher temperature. You get that blood circulation, local cooling effects. Moving the sound head equalizes heat distribution and minimizes excessive hot-cold areas. And this is what we were talking about, the debate on that. So you guys can let me know about that. And basically, you're going to your patient's comfort level as well. You always want to, and we'll talk about this in class, you want to tell them that it should just be, they might not feel anything at all. If they feel a little bit of warmth, that's good, but nothing more than that. We have what we call a periosteal burn. That means where it absorbs way too much onto the bone and it's very uncomfortable, or maybe even sometimes the tendon. So you want to let them know what that adverse effect might be and that is not okay, and they need to let you know right away. And that's when you're going to turn that machine off, and then you're going to have to reassess and change your parameters around a little bit. Okay. Okay, so let's see. Yep. So temperature distribution. So this is a good chart for you, and this might be something that you might see on one of your exams as well, just to kind of help understand the difference between the depths of a 3 megahertz and 1 megahertz, and why one gets hotter than the other, and why you want to keep the intensity lower for the more superficial one. So here's the temperature on this end of the graph, and here's the depth of the tissue. So remember, the 3 megahertz doesn't go as deep, so thus it stops right here, but you can see how fast it heats up that tissue. So why we don't want to have that be too high, and that's why you're at that 0.5 watts per centimeter squared up to probably no more than 1. And generally about 0.8 is a comfortable range for therapeutic effect. Whereas with the 1 megahertz, you can see it's going to go much deeper into the tissue, but it's not going to get nearly as hot. And so you're going to be able to get that therapeutic effect. You're going to raise that intensity a little bit more. And that's usually that range from about 1.2 to, I guess, up to about 2. I don't use 2 very often. Usually about 1.5 is as high as I go. But it depends on the tissue. If you have a big meaty tissue, you might want to go a little bit higher up in those watts per centimeter squared. So this is a great picture, and I think this is in your Cameron book, so it's kind of showing you the deeper versus the more superficial. 3.3, as we saw, that was that 0.7 to 3.3. Some of your ultrasound machines, this is what we'll have. Most of them will have the 1 and the 3 as your choices. Okay, and it's just telling you how it heats up what tissues. Okay, and so here's just talking about that they're going to report of warmth. And so when you're going over a more bony area, you're definitely going to make sure that that patient lets you know how it feels. And oftentimes this is when I'll put it on that 50-50 or that 50% cycle, where it doesn't heat up quite as much. You're still getting a thermal effect, but you're getting a little pulsed, and it's a little safer, so you don't get that heating too fast onto a bony area. And you can see they're both trying to have good contact there. It's really hard sometimes on irregular surfaces, so you might even want to use a smaller sound head. So the fastest rate of heating with slightly warm conduction gel. So that's, the studies have shown that if you heat the gel a little bit, you get a little faster rate of heating. In cold water, it cools the superficial skin. If you ice before you apply it, obviously that's going to reduce the temperature increase of the heating effects. So you really do not want to do ultrasound after you've iced. And plus, we know that ice makes us numb. And so if they were to have any kind of burning, they're probably not going to be able to tell you because they're numb. So it really is a contraindication, a safety issue to do that. So please wait till do your ice till after you've done your ultrasound if you're going to combine the two. Okay, and we talked about the indications here, all the same kind of things that we talked about with the other thermotherapies. I'll let you guys read through those. More indications. We talk about tissue regeneration, bone healing, repair of non-union fractures. So that's a totally different kind of ultrasound that has different parameters and an actual different kind of unit, but it can be used to help facilitate healing of non-union fractures. Trigger points. Usually with trigger points, we'll do a combination where we do the ultrasound and e-stim, and we'll probably demo that in class for you as well. Clinical applications, again, when you have that soft tissue shortening or contractures to help with pain and muscle spasms. We talked about the dermal ulcers. That's going to be more with the ultrasound mist. Skin incisions, surgical skin incisions, different parameters. We got the ligaments. There are studies out there that talk about resorption of calcium deposits. They're not real strong studies, but there are some out there. And then we talk about the bone fractures and the carpal tunnel syndrome as well, is something that's beneficial with this. Okay, we're going to stop right there.